Today, we will explore examples of how to answer the inquisitive questions that a nurse practitioner might be asked in an interview, complete with sample responses. First question. Tell me a little about yourself. When answering the question, tell me a little about yourself in a job interview as a nurse practitioner, it's important to provide a response that highlights your professional background, relevant skills, and passion for patient care, while connecting your experience to the role you're applying for. Here's an example of how to answer this question effectively. Your background. I'm a dedicated nurse practitioner with over 5 years of experience in primary care, specializing in managing chronic conditions and preventive health. I began my career as a registered nurse, working in various clinical settings, which gave me a strong foundation in patient care and a passion for improving patient outcomes. I pursued my nurse practitioner degree because I wanted to take a more active role in patient care, focusing on education and preventative measures to help people lead healthier lives, relevant skills, and passion for patient care. In my most recent role, I worked at a busy family practice where I was responsible for conducting patient assessments, diagnosing and managing acute and chronic illnesses, and collaborating closely with a multidisciplinary team to provide comprehensive care. I'm particularly skilled in building strong relationships with patients, which I believe is key to effective treatment and patient satisfaction. Your experience that is relevant to the role in which you are applying. Outside of work, I'm committed to continuing education and recently completed additional training in diabetes management, which I'm eager to apply in a new setting. I'm excited about the opportunity to join your team because I admire your commitment to patient-centered care and believe my background and skills align well with the values and goals of your practice. Next question, what is your weakness? When answering the question, what is your weakness? In a job interview as a nurse practitioner, it's important to be honest yet strategic. The goal is to present a real area of growth without undermining your suitability for the role. Choose a weakness that you have been actively working to improve and demonstrate how you're making progress. Here's an example. Answer. One area I've been working on is my tendency to be overly meticulous with documentation. I've always believed in the importance of thorough charting to ensure continuity of care and accuracy, but I've found that I sometimes spend too much time on it, especially when managing a busy schedule. To address this, I've been implementing strategies like setting specific time limits for my documentation and using templates to streamline the process. I've also started prioritizing tasks more effectively, allowing me to maintain the quality of my notes without compromising on patient care or workflow efficiency. I've seen a lot of improvement in balancing thoroughness with time management, and I continue to seek ways to refine this skill. This answer acknowledges a genuine weakness that is not critical to patient care and shows a proactive approach to improvement, highlighting your commitment to professional growth and efficiency. Another question that is generally asked, what is your strength? When answering the question, what is your strength? In a job interview as a nurse, it's best to highlight a strength that directly relates to patient care, teamwork, or a specific skill relevant to the nursing role. Your response should include an example that demonstrates this strength in action. Here's an example. Answer. One of my key strengths is my ability to remain calm and focused under pressure, which I believe is crucial in the nursing field. I've always thrived in fast-paced environments, and I find that I can maintain a clear head and make sound decisions even when situations become challenging or urgent. For example, in my previous position in the emergency department, there was an incident where we had multiple trauma patients arrive simultaneously. I was responsible for triaging patients and coordinating care with the rest of the team. By staying calm and organized, I was able to prioritize tasks, communicate effectively with my colleagues, and ensure that each patient received the appropriate care in a timely manner. This strength not only helps me manage stressful situations, but also reassures patients and their families, as I'm able to provide steady and compassionate care, no matter the circumstances. This answer highlights a valuable strength, provides a concrete example of it in action, and demonstrates how it positively impacts both the team and patient care. Where do you see yourself in 5 years? When answering the question, where do you see yourself in 5 years? As a nurse practitioner, it's important to show ambition, commitment to professional growth, and alignment with the healthcare organization's goals. Your answer should reflect a balance between personal development and how you plan to contribute to the team or facility. Here's an example. In 5 years, I see myself continuing to grow as a nurse practitioner with a deeper expertise in my specialty and taking on additional responsibilities within the clinic, such as mentoring new NPs or leading quality improvement initiatives. I'm passionate about patient education and chronic disease management, so I aim to develop a program that focuses on preventive care and patient empowerment, which I believe aligns well with your practice's mission. I also plan to pursue additional certifications, particularly in areas like diabetes management or geriatrics, to further enhance my skills and better serve our patient population. Ultimately, my goal is to be a valuable and integral part of a forward-thinking healthcare team, contributing not only through patient care, but also by helping to shape and improve the services we offer. This answer shows ambition, a commitment to patient care, and a clear plan for professional growth, while also emphasizing how you can add value to the organization over time. Clinical decision-making. Question: can you describe a time when you had to make a critical clinical decision under pressure? How did you handle it, and what was the outcome? Answer: in my previous role in the emergency department, I once had a patient who presented with severe chest pain and shortness of breath. The initial ECG was borderline, and the patient's history suggested a high risk for cardiac issues. Despite the initial tests not being conclusive, I trusted my clinical judgment and advocated for immediate intervention. I collaborated with the attending physician to start the patient on emergency cardiac protocols. It turned out the patient was having a myocardial infarction, and our quick action prevented further complications. This experience reinforced the importance of trusting my clinical instincts and working effectively with the team under pressure. Patient care and communication. Question: how do you approach building rapport with a patient who is resistant to treatment or advice? Answer: I believe that understanding the patient's perspective is key to building rapport, especially with those resistant to treatment. I had a patient with hypertension who was reluctant to start medication. Instead of pushing the treatment plan, I spent extra time discussing his concerns, which included worries about side effects and a desire to manage his condition naturally. We talked about the risks of unmanaged hypertension and explored lifestyle changes that could complement the medication. By involving him in the decision-making process and respecting his concerns, I gained his trust, and he agreed to a trial period with the medication while implementing dietary changes. Interdisciplinary collaboration. Question: can you give an example of a time when you had to resolve a conflict with another healthcare provider? How did you ensure patient care was not compromised? Answer: while working in a primary care setting, there was a disagreement with a physician about the management plan for a diabetic patient who was struggling with control. The physician preferred a conservative approach, but I felt the patient needed a more aggressive intervention due to frequent hypoglycemic episodes. I scheduled a meeting with the physician, where I presented the patient's data and explained my concerns. We discussed the risks and benefits of various treatment options and eventually agreed on a modified approach that balanced both perspectives. This collaboration not only improved the patient's outcomes, but also strengthened our teamwork. Handling difficult situations. Question: how do you manage a patient who is non-compliant with their treatment plan? Answer: dealing with non-compliance requires empathy and a non-judgmental approach. I once worked with a patient with asthma who frequently missed follow-up appointments and was inconsistent with her medication. I took the time to explore the reasons behind her non-compliance, which included transportation issues and difficulty affording medication. We worked together to find solutions, such as scheduling telehealth visits and connecting her with a social worker for medication assistance. By understanding her challenges and providing support, we improved her adherence to the treatment plan, and she experienced fewer asthma exacerbations. Adaptability and continuous learning. Question: how do you stay current with the latest developments and best practices in your field? Answer: I am committed to lifelong learning and regularly attend professional conferences and workshops. I subscribe to several medical journals. I participate in online webinars related to my specialty. For instance, when new guidelines were released for managing type 2 diabetes, I completed a continuing education course to fully understand the updates and best practices. I also belong to a professional network of nurse practitioners where we share the latest research and clinical experiences. Staying informed allows me to provide the highest level of care to my patients and continuously improve my practice. Time management and prioritization. Question: describe a time when you had to manage multiple urgent tasks at once. How did you prioritize and what was the result? Answer: while working in a busy clinic, there was a day when we had several walk-in patients with urgent needs, on top of a fully booked schedule. To manage the situation, I quickly assessed the severity of each case, triaging patients based on their clinical urgency. I delegated less critical tasks to the nursing staff and communicated with the team to keep everyone updated on our progress. By prioritizing effectively and working collaboratively, we were able to attend to all patients in a timely manner, ensuring that the most critical cases received immediate attention while maintaining the quality of care for all. Quality improvement and innovation. Question: have you ever identified a process in your clinic that needed improvement? How did you address it and what changes did you implement? Answer: I noticed that our clinic was experiencing delays in patient flow due to lengthy check-in procedures. After discussing the issue with the team, I proposed a streamlined check-in process that included digital pre-visit questionnaires and a patient portal for updating medical history before appointments. We implemented these changes, and I also trained staff on the new system. As a result, our check-in times were reduced significantly, leading to better patient satisfaction and more efficient clinic operations. It was rewarding to see how a small change could have such a positive impact on both patient and staff experiences. Cultural competence and diversity. Question: how do you ensure that your practice is inclusive and respectful of patients from diverse backgrounds? Answer: I make it a priority to approach each patient with cultural humility and a willingness to learn about their unique needs and perspectives. I regularly attend training on cultural competence and integrate what I learn into my practice. For example, I once worked with a patient from a cultural background that valued alternative medicine. Instead of dismissing her preferences, I engaged in a dialogue to understand her beliefs and found ways to incorporate some of her practices into her treatment plan alongside evidence-based medical care. This approach helped build trust and ensured that she felt respected and included in her care decisions. These example answers demonstrate a thoughtful and professional approach to each question, highlighting relevant experiences and showing how you would apply your skills and knowledge in the role of a nurse practitioner. Navigating a nurse practitioner interview can be challenging, but with the right preparation and thoughtful responses, you can showcase your skills, experience, and passion for patient care. Remember, the key is to be genuine, provide specific examples, and demonstrate how you can be a valuable asset to the healthcare team. Whether it's handling difficult clinical decisions, building rapport with patients, or working collaboratively with colleagues, your answers should reflect your strengths and commitment to providing high-quality care. We hope these tips help you feel more confident and prepared for your next interview. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. And don't forget to subscribe to our channel for more career tips, advice, and insights tailored for healthcare professionals. Thanks for watching, and good luck with your interview.